Hello, everyone, and welcome to Astaria Global's presentation about the orthopedic uses of Alpha2EQ. I'd like to thank the scientific team, which is composed of myself, Dr. Dan Dreyfus, and Dr. Cricket Russillo. And with that, I will get started. This talk is centered around the use of alpha-2 macroglobulin in the treatment of osteoarthritis. The point of this slide is simply to let everyone know that osteoarthritis, as we've learned more over the last 3 or 4 decades, is actually more of an inflammatory process of the entire joint. Years ago, it was described as degenerative joint disease, which indicates that it's related to simply trauma, but that is in fact not true. It is a continuous process that's driven by inflammatory mediators, and gives you the clinical signs that you see in your patients. The important aspect of that is our goals are to stop the inflammation, which in turn allows for the improvement of pain, range of motion, and functionality. But the underlying significant part of this is longevity of our patients, and that longevity comes from our protecting that articular cartilage. I take a moment to make sure that you understand that a very, very similar process occurs in soft tissue. That soft tissue being tendons, ligaments, and even in some muscle applications. But the reality of it is those pro-inflammatory cytokines create an inflammatory response that, quite honestly, is important for that initial debridement. But the persistence of that inflammation leads to fibrosis. And the biggest culprit in this whole thing is collagenase, which, by the way, is a very potent protease. And these collagenases are very effectively bound by the alpha-2 macroglobulin molecule. Just a quick piece of history for you. This product was originally introduced in 2013 as a human medical device for use in discogenic related back pain. That in and of itself should sort of indicate to you the safety profile of this molecule in and around the spinal cord. We did not start veterinary applications until 2018. And since that time, the company has grown significantly. So the functions, if you have seen the respiratory video, then I'm going to speed through this fairly quickly just to give you sort of a quick overview and a review of the functions of the alpha-2 macroglobulin molecule. So first and foremost, it's a non-specific protease inhibitor. It attacks and binds all 4 classes of proteases, and this is really important when we talk about orthopedic disease. In addition to that, it's a very powerful cytokine modulator and binds the important cytokines that we are interested in, the pro-inflammatory cytokines, IL-1, IL-6, and TNF-alpha. But interestingly, one of the more fascinating and currently under investigation more and more is the gene regulatory capacity of this molecule. There's been several studies that demonstrate in models of OA that the alpha-2 macroglobulin molecule upregulates anabolic genes and downregulates the catabolic genes, basically meaning that it upregulates the production of basically matrix by those chondrocytes and downregulates the production of inflammatory mediators, thereby acting as an anti-inflammatory, in addition to turning on cellular functions within those chondrocytes. I think it's important to note that we are highly suspicious, as are many other researchers, that this process of gene regulation occurs in a variety of different cell types. Real quick, this is kind of a schematic, which I think is really helpful. On the far left, you'll see the native alpha-2 molecule in its open configuration. It presents a little bait region that a protease, which is a sequence of amino acids, which proteases love to cleave. So they cleave that sequence, and the molecule undergoes a conformational change that you see in the middle diagram. And that sterically traps the protease and opens up for cytokine binding as well. Once cytokines are bound, then it undergoes one more conformational shift, and that is removed by the reticuloendothelial cells from the environment. Really important. It is removed from the environment, which is quite different than many of the other anti-inflammatories that we use in clinical practice. This is a very interesting and powerful statement about alpha-2 macroglobulin. There's a university in New York that did a phase 1 trial looking at autologous alpha-2 in knee osteoarthritis. It was a non-inferiority study, but it compared corticosteroids, PRP, and alpha-2. As you can see, in humans, it's much easier with verbal communication, and they went through all of the grading scales that are typically used on the human side, and they did 75 patients. They put 25 in each group. At 6 weeks, alpha-2 had the greatest improvement in 2 of those scores, and at 12 weeks, alpha-2 was significantly improved over PRP and had similar effects to corticosteroids in the treatment of knee osteoarthritis. Both alpha-2 and steroids demonstrated better effectiveness than the PRP. Now, I think that's really interesting as we talk about the use of alpha-2 as not, no pun intended, a biological corticosteroid. It acts and clearly has similar anti-inflammatory properties as corticosteroids with none of the negative side effects. So quickly, people ask about the processing. This is a really straightforward process. It is you draw blood, anticoagulated blood, and it goes through a 2-spin process. The first spin is designed to get rid of the majority of the cells and give us a platelet-poor plasma fraction. That platelet-poor plasma fraction is then induced into a proprietary conical filter system and is spun again. And what that does is helps to isolate and clean up the remaining cells and get rid of all the cytokines. So what you're left with is a non-cellular alpha-2 rich end product. So to date, this slide is probably a bit outdated. I'm sure we are in excess of probably 400 to maybe 500,000 joints that have been injected with both fresh and frozen product. We've had probably 5,500 plus horses that we followed for up to 2 years. And as far as adverse effects are concerned, 10 or less, and many of those have turned out to be not related to the injection itself. So we think that its safety profile is incredibly good. A lot of that, I believe, is related to the fact that it's a non-cellular product. We recognize and encourage that alpha-2 is frequently used with other products and other orthobiologics. I think it's important to acknowledge and for all of us to understand that at least for the foreseeable near future, this disease will be managed with a multitude of therapeutic approaches. There is no such thing as a singular comprehensive approach to the management of OA, and it's certainly not on the horizon either. Where's it been used? You pretty much pick a spot and someone's tried it there. Because of its safety profile, because of the volume that we get from our processing, it allows veterinarians to treat multiple sites simultaneously and typically have product left over for treating them again at a later date. Again, a bit repetitive, but the body's natural anti-inflammatory. We find it extremely valuable, and we're getting increasing amounts of commentary from veterinarians using this product that it is superbly helpful in the treatment of horses that have any of the metabolic diseases that we all have a tendency to deal with, right? It's also really important for horses that deal in any regulated environment. You have to look for your individual competition rules and what your governing body is, but I can tell you that there's really nothing in this product that would be amenable to testing. We also find this product extremely useful in the horses that start exercise and training at a very young age, such as Puturities in the Western performance horse world. Those horses start getting injected oftentimes at 2 years of age. And the repetitive use of corticosteroids clearly has a negative impact on their long-term cartilage health. It's important to note that we frequently recommend a series of injections 2 to 4 weeks apart. And we recommend those for those conditions that are chronic. I have a tendency to sort of break these things down into 3 categories, sort of the acute, first-time inflammatory, mild inflammatory synovitis category, which a single injection gives you a very nice, lengthy response to therapy. That group of horses that we all see, that every time you're going to see that horse, you can plan on having some inflammation in its fetlocks or chronic inflammation in stifles, etc. Those horses frequently will have more going on than is evident by radiographs or even with MRI in many cases. So those cases, oftentimes repetitive injections will make a profound difference in their response to therapy and their duration of therapy. The nice thing about this is it has a very rapid onset of action, very similar to corticosteroids. And that reaction its onset is typically within 48 hours. So this sort of gives you a bit of a schematic where you can see that Alpha2EQ has been used quite effectively in combination with all of the therapies that you see on the screen here. Most clinicians are using Alpha2 as an anti-inflammatory and or to help stimulate that chondrocyte metabolism. And then they will use some other form of quote unquote regenerative therapy to be an addition. And now we're hearing increasing amounts of reports about its use with the polyacrylamide gels. What's the difference? So all plasma-based products will have some Alpha2 in it. Understanding that Alpha2 and platelet-rich plasma is in platelet-rich plasma. It's in many other products that are on the market today. But the filtration aspect of what's done by Astaria Global is more important than just concentration. It's twofold. First of all, it removes cells. And the removal of those cells, I truly believe, is a major component why we see so few, if any, reactions to injections. And the second part of it is because of that process, it allows us to freeze that product very effectively for out to a year. So why would you pick Alpha2 over a corticosteroid or some other plasma-based product? And I like to make the comment at the top of the slide. Sometimes it's just as important what's not in a product as what's in the product. So oftentimes we get caught up in the idea that we have this singular comprehensive therapy. I don't think that exists yet. You know, we're all striving to try to find the silver bullet. It certainly doesn't exist at this point, and I don't see anything on the horizon that's going to do that. So combination therapies, as I've already stated, are likely to be with us for some time to come. So the bottom line in this product, the end result is a concentrated, elevated levels of alpha-2 macroglobulin, transferrin, and albumin. We did this work at Boise State using proteomics, demonstrating that we had completely removed the cytokines and that these 3 molecules were the top 3. It's very interesting that a group from Spain just a few years ago published a paper demonstrating that it's the albumin in that generates the cryoprotectant activity and allows us to freeze the molecule. So currently, you may have, and if not, hopefully you will see the presentation on equine asthma and inflammatory airway disease, where Alpha2EQ is being nebulized to patients with inflammatory airway disease and asthma. The protocol is on the screen. I encourage you to watch the other video if you have not, because it goes into great detail about the series of 6. We've also done some work looking at laminitis with regional limb perfusion, and Colorado State University has finished a paper looking at persistent mating-induced endometritis and the use of Alpha2 in that condition as well. So at this point, I'd like to thank you for your time, and hopefully in our Q&A session, we'll be able to answer your questions.